Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 in the United States. As you know, the pandemic began in Asia in late 2019, but it really didn't hit the United States until March, when we had a handful of deaths. The numbers stayed pretty small until about the middle of April, when the numbers began to really increase. These are total deaths in the United States. Such that this week we're at 195,000 deaths, almost 200,000 deaths, and 6.5 million confirmed cases, and a 2% increase just in the past week in number of deaths. I always show this slide because I don't want people to forget that COVID-19 is an important cause of death. In the US, 3/4 of all of our deaths are caused by one of these 10 causes. In a normal 8-month period through the end of August, we would have expected about this many deaths: 430,000 deaths from heart disease, 399,000 from cancer. And that's where COVID-19 was. It's the third leading cause of death. So please don't let anyone tell you that this isn't a serious pandemic. If you look at cases in the United States, it grew and then fairly rapidly grew, came back down, had another spike, and seems to be coming back down. I'm not a big fan of using cases because it's dependent on how many tests we do. So I prefer to look at deaths, and you see this incredible pattern, very rapid growth in the number of deaths, and it slowed down. Then we seem to have seen a second wave in July, and then it's coming back down again. It's very important to understand, though, that the U.S., like the world, isn't a single pattern. This is what the U.S. looks like overall. But remember, we're trying to see it move in the direction of these mature countries like Belgium, Spain, UK, and Italy. When I say mature, I'm talking to the pandemic, not the country. We also see this in our 4 most impacted states in the United States. And if you look at Belgium in terms of percent growth week to week, you can see that it's dropped very quickly down to about 0.1%. The U.S. has dropped very nicely, but it's not quite down to that 0.1% level. And in the past week, as I say, it grew 2.1%. And that's because we're seeing the pandemic spreading out from the United States. We have states like Florida where it's growing quite quickly, Tennessee where it seems to be growing but not quite as quickly, Virginia where it's slowing down, and then states like New York, New Jersey, where it's leveling off. What we hope to see is that all of the states will be moving in that direction. If you look at the U.S., you can see that early on it was around the large metropolitan areas. This is all of the cases in the United States. And now I'll show you just the cases in the past 2 weeks. And what you'll see is it's starting to spread a little bit now into the Southeast and the Midwest. So multiple evolving pandemics. In some parts of the country, we're probably past the worst, but in other parts, we're not quite there yet. So it's still time to take it seriously, do the things that we know make a difference. If you'd like to be added to the website, if you know anyone who would, please let Jan Stork know. As always, I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting these videos. If you have any questions or comments, I would like to hear us address any particular topic, please let me know. I'd enjoy hearing from you. I would like to let you know that I'll be out of the state the next week and may not be able to answer your emails right away, but I look forward to hearing from you. Thank you very much.